Welcome back to part 2 of our interview with Dr. Iannis Adamopoulos. If you missed part 1, you can check it out right here. If not, sit back and relax as he answers one of your rheumatoid arthritis research questions. You know, at the Arthritis National Research Foundation, we're very excited about the work that you're doing, especially in rheumatoid arthritis. Would you consider that kind of your main focus, is RA?
Yeah, well, I mean, RA, as I said, we are looking at certain molecular mechanisms, and I think in rheumatoid arthritis, these cells, the osteoclasts that we are studying, are actually playing a very important role. But studying central mechanisms, such as bone destruction, can play a role in all these bone-related diseases, all the musculoskeletal diseases. But we use RA as a model to study that area.
Well, each year, our foundation hosts our Meet the Scientist reception, and you've been recently. So why do you think it's important to kind of stay in touch with the foundation, and why do you like, coming back and being a part of what we're doing?
Well, they're very nice people at the meetings, I can tell you that. So I've made a lot of friends, actually, and some collaborators from the meeting. So I've met Dr. Bottini at the meeting, and one of his students now has come to my lab, and he's the student in my lab. So not only we have common interests, but there's also exchange of ideas, exchange of different projects, and sometimes of actually personnel between labs. So it is really great to come to the meetings and meet new people as well.
Now we polled our community and told them that we were going to be interviewing you, and we got some response. So I have one question from Monica Vazquez, and she asked, she has RA in addition to ankylosing spondylitis and also psoriatic arthritis. And she said it's very challenging. Is there any treatment out there that can help control symptoms of all three diseases? Right now she said she's on Humira, which controls the psoriasis, but doesn't help the others. So is there kind of a drug that can kind of do all three?
Right. I mean, that's a very nice topic, and I think many people are actually looking into that. My lab has also published a paper this year where we showed that one cytokine, interleukin-17, it's one of these sort of molecules that we are studying, is able to induce in a mouse model both psoriatic features, but also features of inflammation of the joints, but also skin inflammation. So that immediately leads us to think that if you can inhibit this one molecule, then you could possibly target two different diseases. And the idea is that we are now working with another group in actually Boston, where they are looking at another disease, which is actually totally different. It's systemic, actually, lupus erythematosus. And lupus is a totally different disease, but it's still an autoimmune disease, and we have seen that this molecule also plays a role in the same disease. So to answer to Monica, it could be that very soon we may have drugs that they will block one single molecule, and they would be able to work across a spectrum of all of these disorders. And we hope that this will be sooner rather than later.
And that could definitely change the atmosphere of autoimmune diseases for sure, I would think.
Right. I mean, that's why now they're building autoimmune centers where they study the autoimmune diseases as a whole, and they don't really separate them in different specialties, but they sort of see if there is any way that you can bring the rheumatologists and the dermatologists in the same group, and then sort of bring people who would be able to look at the autoimmunity as a whole.
I think that's pretty much all that we have for you. Did you want to add anything? Add anything else?
I think it is nice to see you again, Kyle.
You too.
It's very nice to talk to the ANRF.
Great. Yeah, it was great to see you too, and we are definitely looking forward to seeing what you come up with. We are excited, and we wish you the best of luck.
Thank you.
Thanks for watching Arthritis Now. We're excited to bring you more research-related videos in the future. Don't forget to subscribe to our YouTube channel and check us out at curearthritis.org for all the latest Foundations updates. We'll see you next time.